All right. We are live now. Okay. Good afternoon, everyone. This is the Reverend Charisma Jean Marie. I'm the Director of Racial Justice Ministries at Scarritt Bennett Center, and I welcome you to our Living in the Pandemic Part 2. Excited this afternoon as we welcome our esteemed guests, all Black healthcare professionals. Let me introduce our moderator today. If you were with us last week, you recognize Dr. Calvin Smith. He's an internal medicine there at Meharry Medical Center, and I'm grateful for his time and his expertise and the service he provides in our community. Thank you, Dr. Smith, and welcome, and I turn it over to you.
Thank you so much, Charisma. I am honored to be moderating this panel with some esteemed colleagues and new friends and familiar faces and new faces. We are going to be talking about living in the pandemic, and we have the whole gamut pretty much of medicine covered here. So without any further ado, I wanted to just introduce you guys to our panel. And I'm going to be going in the order that I see. So I'm going to start with my colleague, Dr. Angelica Garrett Wood. Dr. Garrett Wood is a faculty member in the Department of Obstetrics and Gynecology at Meharry Medical College. She's also the Associate Clerkship Director, so she works closely with students, and I wanted to welcome her. So hi. Next, we have Dr. Lloyda Williamson. She is the chair of the Department of Psychiatry, as well as the director of the Psychiatry Residency Program at Meharry Medical College. And I'm sure she wears several other hats, but she's going to be speaking to us about the psychiatry approach and how our mind states are affected by this particular pandemic. Next, I have Mr. Bernard Montgomery Kenyatta, Nurse Kenyatta, and he's based in New Jersey. He's a registered nurse and a certified oncology nurse. So he's working with a very, very vulnerable population, people that are immunosuppressed, and he's right in the heart of some of the roughest aspects of the COVID epidemic. So welcome to you, Kenyatta. Next, we have Dr. Cindy Jones Woods. She is a fellow internist. She's practicing in the Hermitage area of Nashville, which is about north and east of here. And she is going to speak to us about some of the things that we need to look out for when we're caring for people that have COVID, as well as some of the things that we can do to help prevent it and to kind of keep our lifestyles healthy during this pandemic. And then finally, last but not least, we have Dr. Kimberly White-Etheridge. She is a pediatrician as well as a public health specialist. She is also on faculty at Meharry Medical College, and will be speaking to us about how we should be protecting our children during this period of time, as well as some of the issues over the epidemiology involved in this particular epidemic. So without any further ado, I'm gonna go ahead and hand it over to Dr. Angelica Garrett Wood and have her to address the issues of women's health during this period of time, because there are, pregnancies, things of that nature, they don't stop during the pandemic, and probably going to increase during this period of time. And women's health is a big issue in the Black community. So I'd like for Dr. Angelica Garrett Wood to weigh in at this point.
Hi, everyone. Good afternoon. So in general, with regards to, well, let's just start with the GYN aspect of women's health and in this pandemic. A lot of gynecologists have limited amount of patients that they are seeing on a daily basis on their schedule, just to decrease the amount of flow that is going through their offices to protect themselves, their staffs, and their patients. Some things are still crucial that we are still seeing regardless of the limited number of visits. And that is, for example, like contraceptive, those are still important issues to get in and see your gynecologist for. We are pushing out pap smears for the next few months. But however, if your pap smear is due in this year, it still needs to be done. But if you have some grace period, if it's a few months from now, then you're able to, extend it out some there. But with regards to pregnancy, the symptoms of COVID present the same in women who are not pregnant and women who are pregnant. Typically, we're looking for the fever, cough, and short of breath. The difference between a pregnant woman experiencing symptoms versus a non-pregnant woman would be the exacerbation and the effects could make a pregnant woman more sick or sicker than the average woman. Pregnancy itself is a vulnerable state. You know, there's a lot of changes that are going on with the body that makes you particularly vulnerable to certain types of lung infections or asthma or exacerbations and things like that. So the COVID presenting with, you know, shortness of breath could, you know, be worse in a pregnant female. The idea that a pregnant woman can pass COVID to her unborn child has not been substantiated. There has not been any relevant studies that have shown that COVID is passed from mother to fetus, whether it be you know, through the placenta, in utero, or at delivery. With regards to breastfeeding in a COVID positive patient, ideally, you would want to not breastfeed. However, you pump to get the breast milk, because there hasn't been shown that COVID can pass through breast milk. The act of breastfeeding with COVID positive does set your infant up for exposure. However, if you are unable to pump and you do need that direct breast contact, we advise you to take precautions with hand washing and wearing, you know, your protective mask. And then as far as pumping, you want to make sure you sterilize and clean the devices thoroughly after each session. But we should note that breast milk is still a great option, even for a patient who is COVID positive. How to prevent exposure would be essentially the same as all of what the CDC is saying. You know, good hand washing, hygiene. CDC is recommending wearing a mask, and so is ACOG, American College of Obstetricians and Gynecologists. We recommend our patients to wear masks. Limit your exposure. Safer at home. I know we see a lot of states and cities opening up. However, just because they're opening, that doesn't mean you have to go out and jump on the bandwagon and be out. You want to take extra precaution for yourself and for the health of yourself and your unborn child. With regards to maybe some complications associated with COVID, we have seen some women have had preterm labor that were COVID positive, but it hasn't directly correlated to the actual disease. So it could just be a finding that is associated, but not necessarily directly caused by. Women who do test positive with COVID and enter into labor, you'll have to understand that your pediatric team and your OB team are going to talk to you about isolating yourself from baby once baby is born. That's a tough decision for mom and to be isolated from her baby as soon as the baby is born. And although it may be what we recommend in a COVID positive patient, never lose sight of patient autonomy. You still have the right to discuss this with your doctor, with the pediatric team, and then make the best decision for yourself and also keeping your infant safe. I think that's about it right now. And I do know that we're able to ask questions in the comment box. So if anyone has any questions that, you know, I haven't addressed or any additional concerns, feel free to, you know, ask me. But that's about my baseline for now.
That's great. That was a lot of good information, some information I wasn't aware of. So especially a bit about breastfeeding and tips about how to do that. So I'm sure that will be useful to a lot of people. I'm going to next go to Dr. Cindy Jones-Woods. Dr. Jones-Woods, tell us a little bit about some of the best practices for families. And, you know, once a family has a particular member that has a positive COVID virus, is positive for the COVID virus, how should they proceed? And then, you know, some things about protecting themselves if you are a caretaker.
Right. Thank you. Well, I come from a perspective as a fellow internist, and as an internist, we work a lot with preventive maintenance, meaning that we have to deal with things that people can't see yet. So, say you go to your doctor for a physical, at that point, your blood pressure is 160 over 100. 120 over 80 should be normal. So your doctor tells you, she gives you, or he gives you a prescription and says, okay, watch your salt, exercise, do these things, come back in 30 days, right? You come back in 30 days because we need to keep an eye on it, peek under the hood, what's been going well, what hasn't been going well. And at that point, your blood pressure is 140 over 90, a little better, still not down to 120 over 80. So you still have to come back and say another 30 days or 2 months. But we're doing things that to try and keep an eye on things that have not yet happened. I use that same example in that the nation has been given a prescription for preventive maintenance, right? And it has gone over about as well as preventive maintenance goes over in our practices, right? Some people are all for it, and some people just don't understand because we're dealing with things that we can't see. You know, when we deal with high blood pressure, we're not necessarily just treating that number. We're trying to make sure we don't have a heart attack in 10 years. We're trying to make sure we don't have a stroke in 10, 15, 20 years. When we deal with controlling diabetes, we're not just trying to get down to a number, but we're trying to prevent amputations. We're trying to prevent dialysis. We're trying to prevent blindness. So, you know, unfortunately, similar to this pandemic, we're dealing with issues that don't necessarily hurt, right? Diabetes doesn't hurt when you have it. Hypertension doesn't hurt when you have it. And that's what's happening now. You know, we're in quarantine for something that isn't necessarily hurting us at this time, but it has the potential to. So the nation has been given a prescription, right? So what has our prescription been? We need to stay at home. That was the first part. Went over well with some people, not so well with other people. And fortunately, you know, some places are coming out of that restriction, but the numbers have to be coming down first. At least those are the guidelines. You know, the second part of our prescription is that we need to stay 6 feet away from people, social distancing. Again, as we've seen in the news and the media, that's a little harder to do, but it's so that we are not able to spread those droplets, because we know that the virus is passed through droplets from sneezing or coughing or even talking sometimes. So we need to be compliant with that part of the prescription. Number 3, we need to wear a mask in public. That one, again, for the same reason, decreasing droplets, trying to decreasing the passage of the virus, even if people don't have symptoms. And we know they're uncomfortable. They're uncomfortable when doctors have to wear them. So we understand, but it is a necessary evil to decrease the risk and flatten the curve, right? And lastly, that prescription was don't touch your face, which seems to be the hardest part of all, because who knew how often we touch our faces every day. And so the big picture is we know that we're doing something that will help us in the end. And we have a lot of research on things like hypertension and diabetes. We can tell people, if you don't do this 5-10 years down the line, this is what will happen. We just don't have that research, you know, to say, you know, what will happen with this pandemic. But we do have the benefit of our public health officials knowing how viruses work. We know how pandemics work. So we need to, you know, try and use this opportunity to try and educate people on the why, so that they're a little bit more on board. I know as far as access, we have been given the opportunity to do appointments by telemedicine, that we didn't have that opportunity before. I've been telling people, you know, that doctor's appointment you've been putting off for 6 months or maybe a year, this is a great time to call your doctor and say, you don't even have to leave your house, right? And say, I need to get caught up. It's been 6 months, a year. I need my blood pressure. You can get a blood pressure cuff from Amazon, because we all know we've been using Amazon. You can have your blood pressure reading before you get to the office. We can use this time to start exercising. Start slowly, take a walk around the block. We can also use this time to work on our diet. Unfortunately, working from home leads to a lot of grazing, and not necessarily grazing with the right types of foods. We're stressed out. This is, we haven't seen this or been in this situation before. So we use a lot of comfort foods, which are not the best for our immune system. So, to help the immune system, we can do things like zinc supplements, high dose vitamin C, vitamin D as well. And we have to go into public, say we have to go grocery shopping. We still recommend those hand washing measures that have been recommended by the CDC. We see people using gloves when they go out into public, and it's okay to use gloves. I mean, the best recommendation is still to wipe down the cart before you start shopping, and sanitize your hands before and after you finish grocery shopping. But if you're going to use gloves, you have to get rid of those gloves when you finish that activity, and you have to throw away those gloves before you get in your car, because you will cross-contaminate with anything you've just touched, to anything you're putting in your car. When you start driving with that steering wheel, anything you just touched is on those gloves and can potentially be on the steering wheel. So that's really important. And if you're going to use the gloves, the CDC has a good site on how to properly take off gloves. We know we're trained as medical professionals to turn those gloves inside out. And that's important so that, again, that cross-contamination does not happen. So I encourage people to go to the CDC and look on the proper way to remove gloves. And if you do have a family member who is in the home, it's important to, just as we as quarantining ourselves, to kind of isolate or quarantine that person if you have the opportunity. If you have a bedroom that has an isolated bathroom, that is the best place for that person to be. And it's good to get a caregiver, typically a caregiver who does not have high risk for having a bad outcome with COVID themselves. So try not to make grandma the caregiver for the person who already has COVID. A separate laundry is a good idea. Washing the clothing in hot water, avoiding visitors. I know when people are in the hospital, the church and visitors and family want to come by and make sure that Uncle Larry is doing okay, but we have to tell people, you're going to have to FaceTime Uncle Larry. You're going to have to house party Uncle Larry, or Skype or Zoom, so we can, still check on them and use the technology that we have to keep in touch with our family members, but just staying away and still socially distancing. Now, there's also a question of when we can bring that person out of quarantine, right? So they have to be without symptoms for at least 3 days, without fever, without medicine, and no symptoms, no coughing, no shortness of breath. Sometimes it's even preferable to get a test if they're going to be going back into to make sure that their test is actually negative. So yeah, it's just important to use this opportunity to try and take an inventory of where you are, catching up with your primary care doctor, catching up with your exercise, just, changing your perspective and using this time to do something positive while we're under our prescription of preventive maintenance.
Wonderful. Yeah. I cringe every time I see somebody in public with the glove.
I know.
I know the intent is good, but the cross contamination, right. I just see, like, I could visualize it in my head.
Everything they've touched, right?
Yeah, I'm glad you pointed that out. And then the other thing about touching your face, I'm a big face toucher. I got my AirPods in right now, and I was conscious of actually trying to change those. Or get a little bit more pressure there. So big points to hit on. I'm glad you talked about that. Dr. Williamson. So, my Facebook feed is full of my friends who have anxiety right now, who are overwhelmed right now, who are frankly depressed right now. How do we deal with this during this period of time? I'm sure you guys are overwhelmed as well. So talk to us about how we can address this issue.
Thank you, Dr. Smith. I'm so glad to be here. That is a great question. Just a point of clarification, I have had many hats, but I'm not residency training director now. I have somebody else doing that. But as we work with residents, as we work with medical students, as we work with just people in the public, people are just feeling overwhelmed. And one of the things that we have to understand is that our brain is an amazing organ. What it does is it controls our behaviors, it controls our thoughts, it controls our feelings. And so as we are dealing with not just COVID-19, but our regular everyday stressors, whether it's laundry or school or working from home or dealing with aging parents or taking care of infant children, we're dealing with lots of different things. And of course, our community in terms of minorities are dealing with other things in terms of other socioeconomic challenges, discrimination, concerns about racism. Just there's a whole host of factors that we're dealing with now. And then in our community, different communities, we had a tornado here in Nashville just before the COVID-19 crisis pandemic rolled out. And so people are just experiencing heightened levels of anxiety. The biggest thing about this compared to when we've had tornadoes or when we've had hurricanes or when we've had earthquakes in different parts of the country is that we have the event, it's done, and then we deal with it. But this COVID-19 is continual, and it's this pervasive uncertainty that has changed our plans from work, for school, weddings, family reunions, conferences that we want to attend, for education. And so the big thing is understanding there's a difference between what is out of our control and what is in our control. We can't control exactly when the numbers are going to decrease from state to state or community to community. Those things are out of our control. We are not, most of us here are not in the decision-making capacity as to when cities are going to open and stores and businesses are going to open. But what we can control are some of the things that my colleagues have mentioned before. Let's focus on, for example, our brain environment, all right? Just because there's 24-hour, 7 days a week news stories does not mean we need to watch every single news feed. It's repetitious. So if you miss it 6 hours ago, chances are you're going to find it today or even tomorrow. All right. So limiting the amount of news feed that we watch, whether it's on the television, on our computers, or on our cell phones. We've also heard some things about health maintenance and prevention. Just like fruits and vegetables, drinking plenty of water, decreasing the amount of processed foods are healthy for our heart and our lungs, our diabetes. It's good for our brains. Our brains are an organ in our body, just like the rest of it. And it's important because our brain covers and controls the decisions that we make about our general health. So it's important to make those healthy choices in terms of what we eat. It's also important to limit or eliminate harmful substances. Just as tobacco is not good for our lungs on a regular basis, the COVID-19 virus affects our ability to breathe, and it can affect our lungs. And tobacco is not good in terms of our brain function, as well as alcohol and other illicit substances. Rest, getting adequate sleep, stopping to take time and actually plan a regular routine for sleep is so regenerating and helps to decrease our anxiety, and also can help to decrease feelings of sadness and depression. So having a regular time for sleep, good sleep hygiene. I know for myself, watching or listening to this news is not the best thing for me to do before I go to sleep. Do something that's pleasant and relaxing, reading spiritual or inspirational material, the Bible, or watching a comedy instead of all of this news just before you go to sleep. And then we've talked about physical distancing or social distancing, it's still important for us to be connected with people. We are social beings. So even though we can't visit each other in our houses or go to our communities of faith for worship, reach out and pick up the telephone, do a FaceTime, send a letter. We still use snail mail. Put a card or a letter in the mail to somebody so they can get something that will brighten their day. Choosing to have a positive focus, perspective. Just as we can think of a glass as being half empty and think about all the things we're not able to do, we can think about that glass as being half full and think about the things that we can do. Connect with our time, try and develop new hobbies, try some new recipes. And as we're doing those wholesome meals and cooking, doing some things to relax, just a lot of pleasurable activities. It's really important to do those things. We want to make sure that we're balancing the negative with the positive. I want to make a point to say some things about some unhealthy mental health issues. So if you're experiencing symptoms such as constant anxiety throughout the day, things that interfere with your regular work routine, or well, your new work routine at home, being able to concentrate and interact with your family in a positive way, starting to argue, being more irritable, sadness, tearfulness, a lot of fatigue, tiredness, changes in your appetite, so eating too much or not eating enough, agitation, irritability, and then the most serious one, of course, is thoughts of suicide or harm to yourself. If you are noticing any of those things for an extended amount of time, say, for example, longer than 2 weeks, so that you're not able to function as similar to you usually do, you definitely want to reach out to someone. And your primary care provider, as our other panelists mentioned earlier, is this is an excellent time to reach out to your primary care provider. We do have suicide hotlines across the nation. You can text 741 741. That's the number, and text home to that number, HOME. Text that to 741 if you're having thoughts of not wanting to live or thoughts of harm to yourself. We are also aware that everybody isn't necessarily safer at home. So there are issues related to domestic violence, related to physical abuse, emotional abuse, and there are ways you can reach out to the domestic violence hotline. That number is 1-800-799-7233. Or if you're unable to make that call, you can just text LOVEIS, that's love is, to the number 22522. So these are just some of the things that we can do to, while we're safer at home, to decrease the anxiety and the depression that may be coming on as we're feeling overwhelmed, and things to monitor for depressive symptoms, anxiety symptoms, and how to deal with suicidal thoughts and domestic violence.
Dr. Williamson, you eased some of my concerns just listening to you talk, so I appreciate that. I want to, at this moment, just remind everybody that's watching, hello to everybody, all of our friends and family and other colleagues and strangers out there in the world. You guys can all feel free to chime in the chat box and ask questions. We do have questions that have been presented to us already, and we will address those questions at a certain point after we start our initial discussion. So just want to encourage everybody to ask as many questions as you like and be interactive with us. And I promise you we'll engage with as many of you guys as we can, within reason. So thank you so much, Dr. Williamson. And so now I want to transition over to Dr. White's efforts, Dr. Kim. So tell us about the kids, the children. How can we protect them? What kind of things are we looking for in them in particular, if anything at all? And just how do we help them to cope during this period of time?
Well, first, thank you very much for the opportunity to join this panel. It's just wonderful to be on the screen with my medical colleagues. We've got to meet like this more often to be able to give this information to the community. Well, as a pediatrician, of course, my major focus is going to be the health and well-being of our children. And I'm so happy that there are internists here because most of us blame the parents for all of the ills of our children. So part of this is for what Dr. Jones-Woods said, as far as how do you take care of yourself as an adult, is because that helps you take care of your children better. And for kids and COVID, the good thing is that kids have tended to be doing relatively well. The cases when kids are infected with COVID have tended to be relatively mild in that sense. And as it's shown, only about 26% of the kids that have been infected have been under 5 years old. A larger proportion, about 42%, are in that school age, about 5 to 14, and then about 32 or so between 15 and 17. And you can think about that makes sense as far as the interactions that these different age groups might have. When you talk about how do you keep them healthy, a lot of what has already been said reiterates with children. Even though children are not little adults, some of the same things do apply in the sense of the population we're most concerned about, as Dr. Jones-Woods mentioned, is those that have underlying health issues. So our children with asthma are at an increased risk. Our children with diabetes, our children with congenital heart disease, and our children that may be immunosuppressed because of a cancer diagnosis or an autoimmune disease or other things like that. So those are the children that we're most concerned about, and making sure that we're staying abreast of their symptoms and their conditions. When we talk about how do we keep our kids healthy, talk about healthy eating and active living, heal. And it goes the same for whether it's COVID or not COVID, because what we're trying to do is establish a healthy lifestyle that will protect you or help protect you, not just from COVID, but also from flu and whatever else might come down the pipe next. Kids can't eat what adults don't buy. So again, kids are not shopping. They're not the ones with the gloves on at the supermarket. They cannot eat what is not bought. So if the junk food and the unhealthy stuff is not in the house, they're not going to eat it. They can't eat it. They don't have access to it. So making sure that there is a concerted effort to surround them with healthy snacks instead of some of the comfort food, junky foods that we had that. Somebody went online about the COVID-19. You have the freshman 15, but the COVID-19 is even worse, about how much weight people are gaining because they are home and they're not moving. But for kids, increasing and making sure there's a constant source of fresh fruits and vegetables, and of course our whole grains, and also making sure that you're staying hydrated. And hydrated means water, not soda, not 4 cups of juice a day, but just plain water. Whenever you're sick, as long as you're hydrated, you tend to have a little bit less of a severe case of whatever it is that you're suffering from. For families, try to increase cooking if possible, because if you can get some of those fresh meals instead of some of those processed meals, it can be much better for the kids also. We have the option of not cooking all the nutrients and vitamins out of food, which sometimes in fast food and other things, it has already been done. Planning meals. Sit down with the family and plan meals so that you can have a targeted outing to the grocery store and not be tempted to buy a lot of the unhealthy stuff. When you think about what should kids eat to try to help stay healthy, one is, just like was said before, vitamin C. And I advocate more so for looking at diet, not necessarily for adding multiple different supplements to your diet, but vitamin C. Who knew that bell peppers have more vitamin C than an orange? Okay. What a great snack. Chop up a bell pepper with a little bit of cream cheese or so, and it's a great snack. Try new recipes that have ginger or garlic or turmeric in it. These are all things that adults are saying, oh, you got to take these supplements, just cook with them. You get some of the same effects. Add nuts. Nuts are great for zinc, as was mentioned, as well as some of the magnesium. And if you can, any of the meaty fish like salmon or so for some omega-3 fatty acids. So all of these can help as far as increasing your immune system. If you do actually get exposed to COVID or so, kids, as we said, tend to be a little bit more resilient in that sense, but we look for symptoms of fever. We look for a cough. And again, that's why we're so concerned about our asthmatics. Looking for co-infections, meaning they're already suffering from a common cold or something else, and then COVID steps in. Kids have been showing up with vomiting and diarrhea, which is a little bit different than what some of the general adult symptoms are, and also just a sore throat. So all of these symptoms can be signs of COVID, but they can also be signs of a common cold. So that's why we have to be cognizant. If you do have a child that tests positive for COVID, then it's a different set of recommendations also. And only about 2% of kids who are tested actually test positive, or so, or rather 2% of those that are tested are kids that are positive. But again, the symptoms tend to be mild, resolving in about 10 to 14 days, like most viruses, and most can be managed at home through telemedicine, in constant contact with your physician or your provider, but not necessarily needing to come into the office. And the care is very much in that supportive, as we mentioned. The purpose of part of that is also limiting transmission, whereas kids, as we said, don't tend to be as sick. Passing it on to an adult in the family can cause a lot more harm for that adult. And just remember, for babies, that virus has been shown to be spread through soiled diapers. So just keep that in mind as far as hygiene around changing diapers and things like that. So, but for kids, when there's a change in breathing status, children are getting tired breathing, their mental state, they're not as happy as they used to be, they're not as energetic, anything, we call that change in mental status. Any signs of blueness of the lips or the fingernails, a big one, and a change in output for babies. Now all of a sudden you're not changing diapers that much. These are all signs that something else might be going on, and it's time to give a call to your provider, or if that change in breathing is severe, then to get extra help. As we mentioned, recovery is usually in about 10 to 14 days for the majority of kids. And as Dr. Jones-Woods mentioned, the need for isolation, even after the symptoms are gone, we say at least 3 days after you are fever or febrile free before going out, and at least 7 days or so after a positive test if you don't develop the severe symptoms. And one of the things to realize that if you're exposed but don't necessarily test, then the recommendation is isolation for 14 days. So if you're exposed but don't have a test, the expectation is that your quarantine is actually longer than if you actually have a positive test and then recover from your symptoms. So with that being said, the tips that Dr. Williamson mentioned about limiting screen time and watching the mental health, especially for kids get stressed out, especially with hearing this over and over and over, and they don't necessarily know how to process it. So having honest conversations with children and limiting that screen time, as we mentioned, you don't need to see the news cycle 6 times a day. Limit screen time anyway, and encourage them to be active. Whether it's in the house, in your yard, or however you're doing it with your family in the quarantine, teaching them good hygiene, and also using this as intentional quality time. If you remember, it was probably about 3 months ago, you probably said, if I only had time to do such and such with the kids, if I could, I would do such and such. Well, now you have the opportunity. So that intentional quality time with children is what they need, as well as making sure that they have the opportunities to stay connected with their friends and their cohorts through some of the virtual networks, so that they don't get that isolation. And of course, keeping them engaged with their schoolwork.
That's awesome. There's so many good pearls that I pulled from that in terms of dealing with being a parent, because that is something that people don't think about in terms of when they talk to pediatricians. Pediatricians talk to the parents and guide the parents, and cooking with supplements. I mean, I get a lot of patients to tell me, they come in skeptical about how I feel about supplements. And, this gives me a great tool to use with my patients. Cook with the supplements that you want, and incorporate it into your diet. That's so important. Thank you so much. Last but not least, I want to get to Kenyatta, who is in the heart of everything in New Jersey. in the tri-state area, and is actually in the hospital dealing with patients. Again, I want to mention he's dealing with sick patients that are with cancer. He's a certified chemotherapy nurse. And so he's in the heart of it and the thick of it. And I'd like to just hear what he has to say about, dealing with these patients that are in the inpatient setting and dealing with patients that are extremely vulnerable. How is that going, and how can we talk to our family members who are dealing with similar situations?
Thank you so much, Dr. Calvin, first of all, and thank you everybody that showed up. Thank you, Sharizna, too. I know she's a backstage. It's rough. We have a lot of patients who are fearful even coming into the hospital anymore. They rather take their chances with the cancer than coming with the COVID. So we're constantly trying to re-educate and trying to at least soothe some of the worries and some of the concerns for them. Some of them are legitimate concerns. You have a patient that's coming in with a low white count who's neutropenic. They are more at risk. And the problem at our end is that COVID patients are showing up everywhere. So you would think that you have a non-COVID floor, but you're still having patients that are running fevers. And then it's like, we're always working on ways to get the patients safely in and safely out. But our patients some of them been coming for years. They won't even show up no more, and it's sad because, we know the risk of not coming in, but we also understand their fears as well too. So, we are constantly checking and calling, even behind the scenes, following up with those patients, following up with the families, letting them know that they also need to be, even though they may not be positive for it, they should be quarantined as well too. But definitely not to be fearful. If it's an emergency situation, they have to come in so we can still take care of them. Another issue that we're really having is as far as the nurses and what we're dealing with from the perspective of being fearful of giving our patients anything, taking something home with us as well too. And so, there are several of our nurses, in fact, on my unit alone, there's about 8 nurses that are out positive for COVID. And that's scary, it's scary. It goes back to what some of the people were saying earlier about ways that even for healthcare officials, that we have to also protect ourselves, our mentality and, our health, because we're scared. I know that there's several of my colleagues and some of my coworkers who are on Xanax, Ativan, some of them are self-medicating. I think that's very important that a lot of the people in healthcare also have daily check-ins with someone who can get some counseling or support. A support system is very important. The family needs to have an understanding. We have nurses that go home and they don't go straight to the house. They go into the basement, they go into the garage, they go into trailers in some cases. We're trying everything we can to keep ourselves safe and to keep our families safe and to keep our patients safe. And especially when you're dealing with immune compromised patients, you go in and you don't know what you're going to get. 1 minute the patient's fine, they're talking to you, the next minute 103 fever. You're running to get them into a PUI floor or get them onto some help as soon as possible, because we know how that can turn as fast. The good thing is that the numbers are coming down. The cases are getting better. So there is some light at the end of the tunnel. It's just that if people don't adhere to the social distancing with the weather, I think I'm more fearful because what the weather is looking like now and what it's going to look like. And I think people have this misunderstanding that they think, oh, it's nice weather, now we're good. And I think we are now like bracing ourselves for the next wave that's going to be coming through, because we know how entitled Americans think that they are. And because of that entitlement, that's going to cause a lot of people, to get sick again. And so my message would be to the people listening is some of your family members, you're not going to see again after the ambulance comes pick them up again. Or when you go to drop them off at the hospital, that might be the last time you see that person again. So it's so important to adhere to the social distancing until this thing gets better, or till the curve gets better. It's so important for people to take care of their immune system. I don't hear a lot of people talking about building up their immune system. I do hear about, the vitamin D3, vitamin C, the zinc, that's all the stuff I'm on. But I really feel like we need to really start training people to be more cautious, especially with the weather getting better, because that scares me. I see the parties with 1,000 people going to it. I see the people who are packed up into the churches as well too, and the churches can play a better role also in educating people about why they can't be serviced, why you shouldn't be packed up into a house, 1,000 people, even as a house of worship. Unfortunately, at this point in time, we have to be a little bit more careful and more considerate of what are we doing and what's the message that we're sending to the rest of the community when we open these doors of the churches, when we open these houses, because there are people out there who don't have an immune system. There are people out there who are fighting so many different things: diabetes, cancer, kidney issues. Some of them are on dialysis. Some of them have all those things, and those are the people who we're more concerned about, because you may be asymptomatic, don't even know you have anything, and you give it that to your uncle or your brother or your grandfather or your mother, and then what are you going to do? So from a nurse's perspective, we just want people to stay home if you can, practice social distancing, eat healthy. And from my perspective to my colleagues, I would tell them to, do the things that the psychiatrist just told us about. Turn the stuff off. I have people that I work with, they have their telephone on about coronavirus. They're on the laptop with coronavirus. They're on the phone talking to their friends about coronavirus. I mean, it's scary, it's overwhelming, and you really have to turn the stuff off, because it will, especially when we are 12-hour shifts all day long, COVID patients, coronavirus, being fearful, and then to go home to it as well too. It just really increases the idea that you're going to have a mental break eventually. You can't have all that on you unless you change the trajectory of what you're allowing into your sphere of things. So yeah, it's scary. We're trudging on, and the numbers are getting better, but we don't know what the numbers are going to look like tomorrow. We don't know what's going to look like next week. I hope and pray that people understand that good weather does not mean the virus is going away. That's even more reason for us to be more cautious.
And you pointing out this weather situation. I was looking on my feed again, and somebody was pointing out Atlanta right now is acting like it's not a virus.
Yeah.
There are people out in the parks not adhering to social distancing, and the weather's a huge factor in this. And this is going to be a huge second wave is what I'm anticipating. And on a different note, I want to thank you again as a nurse. You guys have more patient contact than anybody. And, out there on the front lines, dealing with the patients and keeping them safe. And what you pointed out with all of your colleagues being out sick and everything like that, it's so important that we commend our nurses, and they're the backbone. I can't do anything in my practice. And I know everybody else who's practicing say the same thing. I can't do anything in my practice without my nurses. So thank you so much.
I appreciate it. Thank you.
So I want to transition, since we're talking about, people kind of relaxing a bit, to, there have been some people who just have not had any belief at all about this virus, period. They don't think, they haven't taken it seriously. Initially, some of the conversation was that, Black people can't get it. If you drink alcohol, it'll make it easier. If you take cocaine, I saw something crazy like that out there. Taking cocaine might alleviate the symptoms of it. And all of these things have been proven to be bunk. And, still and yet, we got our youth in Chicago having a huge house party. We've got the beaches opening in everywhere with the beach. We've got, people storming capitals and things of that nature. How do you want to address these issues? Because a lot of it is built in mistrust in the community from healthcare, and a lot of it is rooted in real, reality. Tuskegee experiment, the experiments that went on at Vanderbilt for the patients. There are countless numbers of examples of things where people have a right not to trust physicians. So why should they trust us now? And how can we work on that situation? And I'll start with Dr. Garrett Wood.
Well, especially it's a lot has changed with regards to the numbers of Black women mortality in pregnancy. So that's already an issue in the forefront now. And then you add this COVID issue, it just makes it greater. I would like to add that, because piggyback off of Kenyatta, as far as he said, his patients weren't coming in anymore. It's still imperative that if you're pregnant, you plan to have your delivery, whether it be in a hospital or a birth center, because that's still the safest way for your baby to be born, despite this risk of COVID. If you undergo, a home birth, you have at least a 2 times increased risk of having a tragedy, a infant death. I would also make sure that you are communicating with your OBGYN so you understand their guidelines, like who is able to come to your appointments, how many support people are you able to have at the particular hospitals, because that has been limited now with regards to the amount of people in a labor room, for example. But part of the growing conversation of Black women staying healthy and staying alive in pregnancy and delivery is having that extra support person to speak when they cannot speak as well. And so if that's going to be your doula or your husband, your spouse, or your partner, allow that person to understand your wishes as well, so they can help speak for you if you cannot. It is hard to there is underlying systematic distrust. And I always say, seek out a physician who looks like you and talks like you, right? Because they're more likely to relate to what you're going through and understand your concerns, or you're coming from your place of reference. So there's many Black, brown OBGYNs out there that we're accepting. We want our ladies, we want our people to come to us, so because we know that we are able to give, if not better care than some of our counterparts. Yeah, that's all I got there, essentially.
I like to chime in
That's
real quick also too. I think also leadership matters. In a lot of ways, this has been a failure of leadership. I'm not gonna get too political here, but I will give Governor Cuomo and Governor Murphy, my governor, they really, have been out in the forefront of this. But it's hard for the public to take this serious when those who are giving us information are not taking it serious. And I think we have to demand, once again, I said before about the role that churches should be playing, or leaders in our community need to be playing as well, to reinforce the importance of us having the social distance, the importance of us not crowding into spaces that we shouldn't be crowding into, to turn off the theories that are going left and right and people are being inundated with. But we have to find the right leadership, and whether that's even in the family, that the head of the household needs to step up and say, no, you're not going out there. You see all these kids out there acting up and no, you my child, I'm going to protect you. You're going to stay right here. And I think we're going to have to get more and more of that from our political people, from our church leaders, from our community leaders. These are the things we need for them to step up and demand them to be examples for our community. And even in the healthcare field, it needs to be the doctors and the nurses also stepping up and saying, listen, this is not a game. I don't care what you're hearing from the top. No, you don't ingest disinfectant for anything, for any reason. Because some people take that seriously, and I'm constantly getting into arguments with people when they say, oh, well, if that's what he says, no one takes him. I'm like, there are certain people who are leaders that people are really going to listen to, because not everybody in their right mind, we got to be honest. All right. So some fool says do X, Y, and Z. They're going to actually try to do it and think that that's going to be the cure. We got to hold those people accountable and say, we got to stop giving those messages, these mixed messages to our community.
Absolutely. Dr. Williamson,
If I can,
weigh in?
Yes, one of the things that's really important is to separate facts from feelings. All right, facts from feelings. Just because you feel good and you feel like you're healthy enough to go out and do everything that you want to do because you're tired of being inside, does not mean that's how you should make your decision. All right. Yes, we're all frustrated. We're tired with this new normal that we had to rapidly adjust to. But don't make your decisions based on your health, your life versus death, based on your feeling. Choose facts. Now, when I state facts, you have to check your fact sources. The CDC is giving out guidelines to everybody, not just underrepresented minorities, not just children, not just pregnant women. They're giving out recommendations to everyone. And so it's important that we check our sources for our facts, not our, Facebook page, not everybody's Twitter accounts are appropriate, but check the facts from people who are reputable resources that are providing information about studies and research. And that makes the difference. But what we do with our feelings is acknowledge our feelings and make sure that we're handling them appropriately. If we're frustrated, find an outlet for your frustration. If you're depressed, seek help, talk to your primary care provider, talk to your religious leader, talk to a best friend. And if you're becoming overwhelmed with anxiety to the point that you can't cope, and let me just say, this anxiety, it's because we're all adjusting to a new normal. There is no precedent for this. This has not happened at all in history before. And so to progress through our days as if, this is nothing new. This is something new. Stop and think about your positive coping skills, your support system. And then, as I said before, try and limit the negativity and build up the positivity so that we can all function with this new normal that adjusts day by day. We have knowledge today that we didn't have 2 months ago. But we have to pay attention to where we get our facts and operate on facts and not our feelings.
I totally agree. Dr. Jones-Wood.
Yeah, I echo that. I think that, when it comes to setting up a relationship with people and coming from the church, we speak a lot about what we call church hurt, where you may have been growing up with religion and not necessarily having the best relationship with that religion. Well, I extend that to kind of doctor hurt or the medical field hurt. So, I know that sometimes when people come to me and they may be frustrated, it's my first time meeting them, and they may be frustrated or anxious or upset. I try and, give them the grace to feel validated and figure out where that is coming from. They may not even relate it back to the Tuskegee experiment. They may just know that their family didn't trust doctors and they don't trust doctors, and they have a problem that has required them to come to the doctor and they don't really want to be there. So I think that it's important people want to be heard, they want to be validated, which is why it's important, like Dr. Garrett Wood said, to go to someone who looks like you and may have been through the same experiences that you have been through. As medical professionals, we've all been through experiences where we have been told that we're not supposed to be wherever we are, right? Either directly or indirectly, right? So we have to kind of get through those layers, but it takes time to give people the space to express themselves, to feel validated. You have to, make sure, do you have any more questions? Do you understand what's going on? And that doesn't always happen. So we have to remember to, that is what some people need. And does it take a little longer? It does take a little longer, but you want your patient to be their own advocate. So if it takes 20 minutes instead of 15, then that's what it takes to make sure that someone is their own advocate. And as far as the house parties in Chicago, I think that in some ways we have to figure out how we can reach our youth, because they seem to be the population that, and it may just be because they're not as affected, because if it's about being with somebody in the healthcare field, the young man in Chicago, his mother was a nurse. He waited till his mother went to work, which is why she was so, upset with him when she found out about the party. But he said, that the virus wasn't real to him. Gun violence is real. His friends dying was real, but this virus is not real. So we need to figure out, do we need to go to where young people get their news? Because it's probably not Facebook. It's not going to be Fox News. It's not going to be YouTube. So we need to meet young people where they are to make sure that we can get the word to them and let them know how important this is. Otherwise, they're invincible, right? They're not going to really see the reason why they need to take this seriously.
Absolutely. All right, we have had so much participation from the audience, and we had some other questions planned, but I'm just going to jump straight into the ones that are directed to some of the practitioners here. So I'm going to start with Dr. Garrett Wood.
Sure.
Number one, is it advisable to wait for a vaccine before planning a child? And then how can a newborn be infected if it's not passed from the mother? Because apparently there might be some cases of that being the case.
So those particular cases out in Europe haven't been verified that it was maternal to fetal in utero. So if the newborn is infected, that's post-delivery. So that's not the same as the mom's carrying the baby inside, and she is positive, and then the baby is infected because the baby's inside. So those are two different, scenarios. With regards to the vaccination, the question was delaying my pregnancy plans based off of waiting for a vaccine. Is that correct? So I wouldn't advise that, first because there are vaccines that we cannot give in pregnancy, and we don't know how this vaccine is going to be formulated. We can't give live vaccines in pregnancy. So vaccines like chickenpox or measles, and we don't do that during pregnancy. So depending on how this new COVID virus vaccination will be made, will determine if it's even going to be safe to be given in pregnancy. So I wouldn't delay my desire to have a child because of waiting on a vaccine or COVID in general.
Awesome. Dr. Jones-Wood. So this is a question that I get surprisingly a lot, actually. Is it safe to rebreathe your own breath? Like when you're wearing a mask, and sometimes people feel like they are recirculating, for lack of a better word, or kind of the same thing that people think when they get on an airplane or in an enclosed space, that they're rebreathing the same air. How do you feel about that? How do you want to address it?
Well, I think it's important for us to remember what the mask is intended to do. It's not necessarily to protect us from ourselves. Our masks are to protect other people from us. So, and as far as the mask, I think that sometimes people get concerned about, because we exhale carbon dioxide and they're going to be, re-inhaling the carbon dioxide and the germs. But if it's a cloth mask, then that's not an issue. And even our N95, so the N95s are set up differently. That's why the masks that help protect people who have the virus in the room, those are the N95s. They're set up to fit completely differently than the surgical mask or the cloth mask. So those are the masks that help protect people from getting infected from someone else. But the masks that are recommended, the cloth masks, are to make sure that we don't have some of that really asymptomatic spread from people who don't already know they have the virus. So it's not a concern. It's not an issue with rebreathing in your own air. Our bodies are set up to handle that, so it's not an issue with those masks.
Okay, one more for you while I'm at it.
I can search the
new cases of asthma.
Just tap the search.
How do you think that there are is there any correlation between some new diagnosis of asthma? Are they being misdiagnosed, and is this some kind of consequence of COVID? What do you make of that?
With rebreathing in your own air, our bodies are set up. Okay.
Sorry about that.
That's okay. So you said people are being diagnosed with asthma.
Yeah.
Well, unfortunately, COVID-19 has come in allergy season, right? Those two are right on top of each other. And we know that sometimes allergies can then trigger asthma symptoms or even reactive airway disease, where you may not have asthma, but you get an upper respiratory infection that behaves just like an asthma exacerbation would be. I know that we know that COVID-19 specifically targets the lungs. But it typically causes like a bilateral pneumonia, which looks different and behaves differently than asthma. So I'm not sure. I would have to do some more research on if there's a correlation between COVID-19 and people being diagnosed with asthma. But what we don't know is that, the long-term effects from people who actually have had COVID-19, if they have any long-term effects on their lungs that actually change the architecture and make them more at risk for asthma down the line. But at this point, it may be more a reflection of this time of year and the pollen in our cars being yellow and the trees and the grasses and that's why everybody wants to go outside, right? It's springtime, causing those symptoms that look like asthma.
Gotcha. Okay, so Dr. Williamson, there's a ton of questions for you, and I'm gonna kind of toss a couple of them at you, and then we'll go back to some other people. But one that I found really interesting was a question about sobriety, the issue of sobriety. People don't have access to AA meetings right now, or don't know how to access them remotely. So what would you say to recommend to people to stay sober and healthy during this period of time?
Sure. Thank you for asking that question. It's a great question. So in particular, the group Alcoholics Anonymous, although those meetings are all across the world, all across our nation, they operate independently. So people should be aware that even though they can't go in person physically to a meeting, that those meetings have also gone to various platforms. So there may be phone calls or Zoom meetings. And so they just need to check with the local meeting that they're used to attending or the city to see what platforms are available. That goes for NA meetings, AA meetings, and we're also being able to connect with individuals who receive treatment for opiate use disorders, so medication-assisted treatment or MAT meetings. Those are also being provided from providers using different platforms, whether it's telepsychiatry or phone calls. Counselors and therapists and physicians are checking on those individuals to make sure that they can still get those treatments. So again, we're all shifting rapidly to a new normal, but there are treatments available for those individuals.
Awesome. And so with another thing in mind with COVID, one of the symptoms that has been listed very frequently is fatigue and a feeling of a low energy. But we also know that that's also a symptom of depression. So how can we kind of differentiate that, and should people be worried about that particular symptom if it lingers?
That's also a great question. So fatigue can be a symptom of lots of different things. Medical problems, like Dr. Jones-Woods had mentioned. You're also concerned with fatigue during pregnancy, particularly during first trimester. So all of our regular functions, all our people aren't, because we're in this COVID-19 crisis, people still are experiencing problems with diabetes, hypertension, first trimester pregnancy, but it can be part of anxiety or depression. So the main thing is, if you're experiencing this for an extended amount of time, stop and reflect and see what may be different in your lifestyle, in your life patterns. And then if you need to, reach out and talk with your primary care provider. They can help sort through what we call a differential diagnosis. Is this related to your heart? Is this related to your lungs? Is this related to your circulatory system? Are you anemic? Are you losing blood through your gastrointestinal system? When that all checks out normal, your primary care provider can also check in and with you and say, hey, so how are you really coping with this? How have you been feeling? How are you sleeping? Are you feeling down? Our primary care providers are the first persons of contact for many people who are experiencing anxiety, depression, and other issues. OBGYNs are included in that, internal medicine, and pediatricians as well. These are the people who have first contact more often than not with people who are experiencing fatigue. And so we need to make sure, don't ignore it if it's going on for a long period of time, and if it's impacting your relationships, the way you talk with people, your ability to work from home, your ability to assist your children with their schoolwork while they're working at home, your ability to just get up and be motivated and be energized to do things that you used to do. Pay attention to it, don't ignore it, because when we address these things, particularly fatigue and other mental health symptoms earlier, as well as medical symptoms, we're preventing complications down the road.
Wonderful. Okay, so this one is kind of a tag team between Dr. Garrett Wood and Dr. Jones Woods. And I'm gonna start with Angelica here. So there was a question about women taking combined oral contraceptive pills who become infected with the virus. And are patients at particularly high risk with those, particularly keeping in mind the correlation with developing blood clots and what we're seeing about that?
Okay. Yeah, so that's a good question. There hasn't been any linked increase for women who have been on contraceptive pills and testing positive for COVID. As of right now, whatever contraceptive method that you choose, whether it be OCPs, IUD, Nexplanon, Depo, those are all safe to continue even if you are positive for COVID.
Okay, awesome. And then so Dr. Jones Woods, can you talk a little bit more about what we're seeing now about embolisms and strokes and the fear that we have about that now?
Right. So when we first, when the CDC first talked about the symptoms that we needed to look for COVID, we had 3 symptoms, right? I think Dr. Garrett Wood mentioned those: fever, cough, and shortness of breath. Now they've extended those symptoms to include, I believe, six more symptoms: sore throat, abdominal pain, and so that's all a reflection of, as we find out more about the virus, we can get more data on what to look for. And it's turning out that, the virus is kind of a chameleon of sorts, is what we're finding out. It's a good imposter. It can look like a lot of things. And one of those things that are showing up, which is a reflection of the inflammation that the virus is good for causing. That's part of what the reason why it's so devastating is because it causes what's called a cytokine storm, which we're supposed to, be helpful for our immune system, but it turns our immune system against us and makes it overreactive, which is where the body just tries to take over. And in the process, it causes all of this inflammation. And we know that inflammation can lead to what we call hypercoagulable states, where you're more prone to clotting. We see this estrogen, we know, makes you hypercoagulable. When you have cancer, you can become hypercoagulable. And we're finding that the COVID-19 virus, unfortunately, is also making people clot more easily, which turns up in strokes and peripheral angiopathies, right? We've seen quote unquote COVID toes is one of the descriptions, where the small blood vessels in the feet are affected, or the larger blood vessels in the brain are affected. And some people are presenting with strokes and don't have any other signs or symptoms of COVID. So it's really important to know that this disease can look like anything, which is why it's so important for us to continue to try and decrease the spread from one person to the next. Because even though you don't have symptoms, you can still spread it to someone else, and that person can have a bad outcome, especially if they have those chronic diseases: high blood pressure, diabetes, congestive heart failure, kidney disease. So that's why, prevention is the best resource that we have to try and keep this awful virus from continuing to spread.
Dr. Smith, I just
Yeah.
would like to add that now, if you are on OCPs and you do get diagnosed with like a DVT or a PE, then your OBGYN will take you off of that
Yes.
birth control mechanism. But as far as stopping just because of a positive test, that's not indicated.
Absolutely. Thank you for that clarification. So this question is a general question, but I'm going to direct it at Dr. White Ethers, considering her background in public health as well. What kind of changes do you see in the long term as far as the general practice of medicine and public health as it relates to this pandemic? What lessons do you think we will learn from it, and how do you foresee us changing the practice of medicine individually going forward?
Well, thank you. I think that's a really, really relevant question right now, as far as what does post-COVID life look like in that sense? And one of the things from public health is that we have been preparing for pandemics and things like this for years, between training and between looking at what are the type of services that need to be provided. It may not have worked as well as it was prescribed to do because of forces beyond the control of public health. But this is kind of this is what we do. If you think about what was life like before the Spanish flu or the flu of the 1919, when millions of people died around the world, and we came out stronger on the other side of that with increased knowledge of how diseases are spread and the importance of hygiene. And the assumption is this will also teach us a lot about our behaviors. It'll definitely teach us about the importance of taking care of ourselves and making sure that we're in the best health so that we don't increase our susceptibility to whatever comes down the road next. But I think one of the most important public health things that it does, it stresses the importance of prevention and vaccinations. If you think about, and any of us on this panel have probably had a conversation with a patient who didn't want a flu shot, and talking about how deadly the flu can be, especially for certain age groups and certain populations. And no, I don't want a flu shot. I don't believe in that. You get the flu and you get that. But now we're sitting here on our hands waiting for a vaccine for this disease. And the question is, so we know the flu is deadly. We have a vaccine, people don't use it. When and if there is a COVID vaccine, that doesn't, if we build it, that doesn't mean it's, people will come. So looking at how do we work differently, we're probably going to be in mass for a little while. We're probably going to be social distancing for a little while. Life is going to look a little bit different than it does now. I assume that things that are delivered to the houses will continue to gain in popularity, and things that require people to be in close contact with each other probably will continue to be held a little bit at edge. But I think that from public health perspective, being able to look at where the positives are, who is at risk, and really be able to use the science that we're trained in to see what kind of response we need to have in different areas is going to be key. So it has taught us a lot about our behavior as a society, and it's also taught us a lot about our resiliency as a society. And I think that some of those lessons that we've had will help us move forward through that. And as long as we maintain the I'm going to say, as long as fact and truth remain working together, then I think that we'll be fine. Right now, we have a little bit of a divergence between fact and truth, and that's caused a lot of the controversy and confusion that we're in now. So if we can get back to that point, because science should always be in that realm of fact and truth, but right now that doesn't seem to be happening.
Yeah, unfortunately. Dr. Williamson, you want to weigh in here?
Thank you. This is a great question. Two things that have happened, I think, affecting my practice is, number one, or just the medical community, is that people have understood or seen value in terms of telepsychiatry and telemedicine. This has been around for years, 20 years we've been doing telepsychiatry, but it's been regulated by individual state boards. And so depending on the caution of the individual state licensing boards for providers, for medical providers, physicians, nurse practitioners, PAs, they've been hesitant. And now we've rolled it out rapidly. So I'm really believing, because we have data, studies have shown that video conferencing, when I talk about telemedicine, that's video conferencing in a HIPAA or a secure patient privacy, paying attention to patient privacy, works. It's effective. And so I'm hoping that once we get through this COVID-19 crisis, that we don't roll back to that. The second thing is that there's a lot of talk about mental health, and it has been ignored for so long. Mental health should not be separated from our general physical health. And I'm hoping that we will continue this emphasis and understanding and inquiry about not just treating disease, but promoting mental health. As Kenyatta stated before, you talked about your coworkers, particularly nurses that are on the front line and how they're taking different medications or self-medicating. It's important for anxiety to be treated appropriately, depression to be treated appropriately. It's unfortunate that as health providers, healthcare providers, we are in another risk level. And so suicide in primary care providers, nurses who are frontline and physicians who are frontline, suicides are occurring. And so the stigma against mental health needs to be eliminated, and we need to treat it like heart attacks, like diabetes, like eclampsia, where people die because people do die from mental health issues. And so I'm hoping that this happens.
Absolutely. I couldn't say it better myself. I'm going to switch it over to Kenyatta really quickly. There's been a lot of misinformation spreading specifically about the amount of deaths in the hospital. People say, oh, it's not that big a deal. People aren't really dying. Can you talk to us about your experience seeing patients in the hospital dying versus patients surviving with COVID?
It hasn't been pleasant. People are dying. It hasn't been pleasant. You're literally walking down the hallway and there's bodies passing you 3 an hour on a 12-hour shift. So, you know, we've had at my hospital at one point there were 49 people that died in 4 days. And then, you know, on top of that, when you're hearing the constant codes going on, code stroke, rapid medical codes, I will say it has slowed down. And that's how, you know, we've really seen that the social distancing is working in that sense. But for the most part, if you have a comorbidity, you know, this is not something you want. It's not something you want. And people are dying. I think that's the problem. The public doesn't see that part. That's why it's easy for a lot of people to go out and want to be on the beach or go out and be in a party because they're not seeing the end result that we're catching every day. You know, so even when they say this, the curve is coming down, we're still seeing that the deaths are still occurring. One of the reasons why, you know, the curve may be going down also because so many people have died already. But this is not nothing to play with. This is not nothing to play with, and people need to be very careful with the information that they're getting and allowing to be filtered and without the proper resources. Make sure that they're legitimate. You got all these false articles that are popping up. Hearing stuff about 5G and all this other stuff. I mean, people are really taking this stuff to heart, and it's like, where are you getting this information? Oh, I heard it from my boy. Or I heard it from, you know, right from down the street. And you have to get your information from reputable source. Maybe it's CDC, maybe it's someone that's in the hospital, a physician. Contact your primary if you're not sure. If you don't have a primary, find one. Call the hospitals, you know, because this misinformation campaign that's going on by some people who don't want to be in the house, who don't want to be social distancing. So they're pulling things out just to create this hysteria that is occurring. And people are dying. People are dying. They're still dying. They're recovering. You know, praise God, they're recovering. But it's real out there. It really is. And just because I have arguments by people saying, well, if I want to go out and I want to get sick, then that's on me. No, it's not on you. This is a public health issue. That means if you go out and you're sick, you're going to ineffectively get me sick or somebody that I love or I care about. And that's what people don't understand. It's not a time to be selfish. You got to be smart, and you got to question the information that comes to you as well, too.
Absolutely, man. On the last talk, we talked about consideration for other people and humanity, and you spoke directly to that at your last point. I'm going to address the last question and then kind of toss it to you guys individually If you want to answer, it was asked, under what circumstances would one go to the ER for breathing issues and not be tested for COVID-19? I think at this point, from my opinion, just about everybody is going to be tested if they're starting to feel to have any of those symptoms. I know personally for our screening site in Nashville, we screen everyone. We do ask questions about symptoms for research purposes, but if you come to our checkpoints, you're going to be screened for it. And I think that most ERs are, the limiting factor previously was the number of tests available. Well, now that we have more tests available, people surely need to be screened for it. We need to know, actually, I would argue it'd be more important for us to know who doesn't have it, who's not positive, and who the positive asymptomatic carriers are, so that we can kind of really understand how best to utilize the social distancing that we're going to have to use for this new normal, as Dr. Williamson pointed out, that we're adjusting to, because it's a new normal for us. We're having to deal with something brand new, and it's brand new for the doctors, it's brand new for everybody. But I think to get to that question, I think that everybody pretty much is going to be tested for it if you're coming in with breathing problems. I think that's a part of that algorithm. I can't think of a circumstance, even if you're coming in with really suggestive symptoms of heart failure, why not test it? But I don't know if any of you guys feel any differently, so I'll open it to you guys.
This is Dr. Kim. From the public health standpoint, of course, knowing where our pockets are, knowing where the infection is still has the potential of growing is key to ever being able to open back up and getting back to whatever this new normal is. If we know that there's not a lot of transmission happening in a community, the numbers have plateaued and have been going down, then we can feel more comfortable with about possibly easing some of the restrictions that we're under now. That doesn't mean we go back to no mask. It doesn't mean we go back to football games and soccer games and all the things like that. That's going to take a little bit more time. But the only way we're going to be able to make progress is through increasing that testing and actually doing some of the contact tracing. So you're positive, let me see who's been around you, who have you been exposed to, and see if they're positive, and see if those people that they've been around to are positive. Similar to what we do with almost every other disease from the public health standpoint. And once we're able to have that information and make decisions based on hard, true facts, then we're able to see what this next step, this post-COVID world can look like.
That's awesome. Anybody else want to weigh in before I toss it back to Charisma?
I just think that it's important that you have to be your own advocate as well too, or at least have someone. If you know there's someone that is in healthcare, or even a strong grandma, somebody that's gonna put fire under people behind. I've had even nurses tell me that they weren't testing their husbands or their wives, and they insisted they were not leaving until they got that test. So my thing is, you have to speak up for yourself. You have to become an advocate. If you can't be an advocate for yourself, get somebody who can be. Because I've had to have conversations, or I have gone to certain facilities to say, listen, this person needs to be tested. Because sometimes they will say, oh, I'm just having a stomach ache. They miss out on the fever. They miss out on the shortness of breath. They miss out on the diarrhea. So someone needs to be there. If you're not an advocate for yourself, get somebody who can be a strong advocate for you.
Absolutely. Okay, I'm gonna toss it back to Charisma and let her kind of close out. I wish we could answer all the questions because it's been just so, so informative. But we don't have all the time in the world. So back to you, Charisma.
Thank you. Let me say thank you all so much for your wealth of knowledge, your time, your passion, and your service to the community and world. This has been such an amazing hour and a half of just wealth of knowledge. So thank you all so much. And thank you, community, for joining us. And I just want to say thank you for joining us for this part 2 of the Living in the Pandemic, hosted by the Racial Justice Ministries at Scarritt, Bennett, in partnership with Meharry Medical College. As some of you may already know, Scarritt Bennett Center is a not-for-profit organization whose mission is to create space where individuals and groups engage each other to achieve a more just world. Please consider supporting Scarritt Bennett Center's work with a donation during this week's Big Payback event, which is a 24-hour giving event, March 6th at 6 p.m. May 7th at 6 p.m. Visit scarrittbennett.org during those 24 hours to make a donation. Our hope is to continue to engage our community by live streaming, bringing in the best in the field to help us be informed. Tune in next week for a special Mother's Day program we will have entitled Black Women, Grief, and a Mothering Spirit. That will be at 6 p.m. and more information we will have for you. I want to thank again this great panel, and to close out, why don't we get you all to just share just wisdom, your last wisdom words of wisdom for our community as we end this program. Let's start with you, Dr. Garrett Wood.
So I kind of piggyback off of what Kenyatta said. You know, you are the master of your fate. If you feel as if something is wrong, pregnant women, ladies, then something is wrong, and advocate for yourself and speak for yourself. Just because, like I said, you know, the cities are opening back up doesn't mean you have to be the first person in the wave. You know, common sense is also one of the best ways to keep yourself safe. So, you know, let some others experiment out there first before you know, get out there in the streets. Okay. So everyone stay safe, and thank you for having me.
Thank you. Dr. Jones-Woods.
Yes, yes. Thank you so much. This has been a great opportunity. I would just like to echo that we really need to use this opportunity to, again, become better advocates for our health, catch up, see what your blood pressure is. You know, are you one of those people who have one of those chronic conditions? Make sure that you know what your blood pressure is, what your blood sugar is. Get in touch with your doctor, and just make sure that, you know, the Maya Angelou quote, "Do the best you can until you know better. Then when you know better, do better." And at this point, we are getting the information so we can know better, so we can go out there and go forth and do better. Thank you, guys.
Thank you. Dr. Kimberly Edwidge.
And again, thank you for this opportunity. It's been absolutely wonderful. I think the closing message for me would be to remind us that, yes, our children tend to do well, but that doesn't mean that they're not suffering through this pandemic, and to always remember that this is the opportunity to kind of reset health, because the health habits that we set with our children now are the health habits they'll have with a lifetime. So take this time, as we said before, all the things that you wish you had time for, now you have time for it, and do it. And just remember that all of us as healthcare providers have taken an oath and put forth the sacrifice to make sure that what we're doing is for the good of the individual patients and the community. So if you have any questions, any concerns, then reach out to your primary care doctor. That's what we've trained for. That's what we dedicated our lives for.
Thank you. Thank you. Awesome. Dr. Williamson.
Yes, thank you for allowing me to participate again on this panel. I'm just going to remind everyone that our brain is an organ just like our heart, just like our lungs. And we have to be intentional about making healthy choices for our brains to be able to function in the best environment. So when we're feeling out of control, particularly related to this COVID-19 crisis, remember, there are some things that we can control. We can choose to think positively. We can choose to make good decisions about what we eat, what we drink, how much we sleep, what we watch, what we listen to. And we can choose to contact our primary care doctor or another health professional if we are not functioning as we should. Thank you so much for having me.
Awesome. Thank you. Nurse Kenyatta.
Sure is not. I love you, number one. I would say my final message is just stay faithful, stay positive. We will get through this. It may take some time, but you know, be safe, be smart, and don't risk it if you don't have to, please. But God is still in control.
Amen. Amen. And finally, our moderator and friend for this discussion, Dr. Calvin Smith, what's your final words of wisdom for our community?
All right. So first and foremost, I want to thank everybody on the panel. It was phenomenal. All of the people that watched and chimed in, asked questions. Thank you guys so much, because we can't do what we do without you guys. I think a lot of really good, truthful, factful information was handed out. So I want to ask everybody to just be kind human beings to one another. Remember, we're all trying to go through this thing called life as human beings together. And you might not understand where everybody comes from or what they're doing or why they're doing it, their motivation, but just remember that they're humans at the end of the day, and be kind to one another. I want to leave you guys with two things that my dad, my namesake, Steve Miles Smith Jr., AKA Ralph from Ben Hill, those in Atlanta, or Steve Miles and those in Baltimore and DC that listen to him on the radio said. He would always leave me with these two things. Number one was a Bible verse, John 14:1. Let not your heart be troubled. Especially during this period of time, let not your hearts be troubled. This is not the end for us, and we have so much more to do. And the second thing is, don't fall for the flim flam. The flim flam is out there to be fell for. Don't fall for it. As Dr. Williamson pointed out so eloquently, vet your sources and come to people that you trust. And if you don't trust them, go to somebody else that you trust. But trust in sources that are verified. Don't go on bad information, because going on bad information and spreading bad information is just as bad as the COVID. It'll kill us as fast as COVID. So with that being said, I don't have anything else other than to thank everybody on the panel. Thank you, Charisma and the Scarritt Bennett Center. And I'm going to be donating. I'm challenging everybody on my friend feed, if you have the means, because I know it's rough right now, but if you got $5 to spare, even give to them, give to Meharry, give to whoever you can give to, because we need those things to be able to keep going.
Thank you. Thank you all so much again. God bless you, and we'll see you again. Have a great one, everyone. Bye-bye.
Bye. That was awesome.
Are we all? Oh, we're still live.